In this next episode, Adi Fromm is going to tell you the one thing that quietly limits your results and how Dr. Tan changed how he treats forever. If you work with patients, this is the kind of episode you will want to come back to. Let's go. Hey, welcome back. I'm glad you're here. Whether this is your second episode with me or your first, the fact that you keep showing up for your craft, that already separates you from most people in this profession. Let's make it worth your time. Today, I am sitting with one of the few people on the planet who can honestly say, I learned this from Dr. Tan. Not from a recording, not from a textbook, but from the man himself. His name is Adi Fromm. He studied directly with Dr. Tan, earned his personal blessings to establish the Israeli Tan Center. He has written not one, but two books, and is now one of the most respected teachers of the balance method working today. But here's what I want you to understand before we start. Adi doesn't carry this work as a copy. He carries it as someone who watched it being shaped. And that's a different thing. So everything you hear today, it is not secondhand. It is from the source. Adi, welcome. Thank you for being here.
Thank you for having me. It's my pleasure to be here.
That's
Thank
great.
you.
So as a Balanced Method ambassador, can you give a little introduction about yourself?
Okay, thanks. So I've been practicing Chinese medicine for approximately 27, 28 years already. I am currently presiding as an official consult for Canaan Hospital in Haining, China. It's an oncology hospital combining West and East. I am also the dean of one of the biggest schools in the West for Chinese medicine. In Israel, it's a 4-year program. Name is Reedman College, and we have about 1,000 students there. I don't know if any school is bigger than that, but that doesn't matter. I know it's one of the big one, and we have over 4,200 hours of Chinese medicine, including clinic. And one of our clinics is actually being done in a public hospital. It's like their internship is being done in the last year in a public hospital. And for what we are together, I've been practicing the balance method for approximately 22 years. And I have the Dr. Tan Gold certificate. I've been learning from Dr. Tan himself. I've attended many of his seminars. I hosted him in Israel for many time. And in 2013, we established the Israeli Tan Center together, which was one of his ideas to create centers in every country that will do teaching, research, development. But unfortunately, he didn't live up to fulfill this particular dream.
Wow, so you have a lot going on every day.
And actually, I've been teaching the balance method all over the world. I think somewhere like 15, 16 different countries already.
Amazing. That's amazing. And you were talking about the gold member. Can you talk a bit more about that?
Oh, that's a fun story. Actually, the entire idea came from a conversation we had with Dr. Tan in Tel Aviv when he was staying with us, and he started talking about his legacy. I think it was 2011 or 2012, something like that. Started talking about his legacy, and since I've been around, I didn't mention it, but I was also the head of the Israeli Association, and I know some. I told him, look, you can't really prevent people from teaching your method. There's no real way to prevent it. And beside the legal issues, I don't even think it's good. And if you want things to grow, you can't over control them. It's like creating a bonsai tree. It won't give you fruits.
Yes.
You need to understand that people learn from you, they can teach it, they can use it, and the only thing you you don't want is that people will misinterpret what you're saying or mislead people or disrupt this method. So my idea for you is that you will create like I copied it from the Kiko Matsumoto style. Actually, I'm not embarrassed to say. You have official teachers, and then whoever teaches who is not an official teacher, then people just know he's not an official teacher, and that's it. So you have people that you trust them to follow the method, and then from this came the whole silver and gold member, that the gold member are like an official teachers of the method. That was the original idea. Again, um, as far as I understood, the silver and the gold was just the silver was just a way to reach the gold, so you could
Okay.
follow up some degrees. Uh, but basically, that was the idea. And since unfortunately he didn't live long enough to really establish it, and a lot of people don't know that that was the original idea. And again, for me, if you want something to grow, you have to also let it be free.
Hmm.
You can't hold it too much, and then if you just hold it too much, then people will just copy it without giving you credit, or they will change it because they have to change it, and then you get the interruption instead of the real thing. And I see it in many places that people say, oh, I'm teaching the balance method. They say, oh, I learned that, but I learned it as in a different name. And then I said, oh, yeah, that's what happens when you try to over control things. Then instead of balance method, I will call it the harmony method. And then what?
Yeah.
And what can they say that in the harmony method, stomach doesn't balance the spleen? There's no yin and yang relationship in my harmony method. And then I told him that it will people won't use your name, and then nobody will remember your name. What's really going to happen. And unfortunately, I see it sometimes happening. People are teaching the balance method without even saying that Dr. Tan was the one establishing it, founding it, understanding the necessity of it. So they just teach the balance method. They don't even know who Dr. Tan is, and that makes me really sad.
I can feel that. Yeah. Yes. So you were talking about attaining a certain level. And for the therapist who's watching right now, who's already pretty good at what they do, what is the truth about what it actually takes to get there, to reach that certain level?
I go back to my conversation with Dr. Tan himself. When he formed the balance method, the conversation started, and I guess some people here will be balance method enthusiasts, or so they know a little bit about the balance method. And I asked him a question that many students ask. They say, okay, the spleen can be balanced by the lung, the spleen can be balanced by the stomach. How can I choose between them?
Mhm.
And he always said at the beginning, kiss the patient, anatomical structure similarity. You always have to kiss ass. Thank you. That's very nice. And then when we had a private conversation, he said, basically, um, you can tell. You can tell. You can tell by the pulse. You can tell by abdominal. You can tell by palpation which meridian will be the best for this particular patient. But then again, we're taking you to a complicated method instead of a simple one.
Mhm.
And the one thing he really wanted, and I think that was the most ingenious of the entire system. It's not just the method, it's the necessity of the method for practitioners in the West. Now, I work in China. In China, the scholarship, the way they learn, it's exactly like Western medicine. You go to the university, then you go to the hospital, then you have your department, then you have your master, and there is always a teaching ability. In the West, it doesn't matter where you learned. It doesn't matter if you have a 4 year program or a 2 year program. Once you're finished, you're on your own.
Yes.
And when you're on your own, you don't need more information. You don't need complicated ideas that will say, oh, this teacher is a genius. You need simple ideas that you can become your own master. This is what now I'm quoting him. I'm giving you principles to become your own master. If I will tell people when they first learn the 1, 2, 3, now you got to learn, you have to be with me for 5 months to study pulse and 5 months to study abdomen, then it's just mixing, taking one complicated idea that I don't know what to do with, which is TCM, and changing it into another complicated idea. And then if I will show you that I'm taking pulse, for example, or palpating the meridian, and then you would say, oh, he's a great practitioner and he's a great doctor and he's a great teacher, but I can't do that. And his entire idea was, yes, you can. You need to understand the logic of the method. And what happens if you make a mistake? Basically,
The patient will
nothing.
explode.
Nothing happens.
No.
Like I tell people, there's no balance method police going to come knocking at your door saying, hey, this person needed the lung, you didn't do the lung. You have a problem on stomach meridian, you use the spleen, it's not working. You use the lung, you use the lung, it's working. Next treatment, you start with the lung. That's it. That's
Yeah.
it. And then when you have it, when you got it, then to become better, you need to follow up your work. You need to make sure that you're doing the right thing by following up your work. You learn from your success, you learn from your failures. This is how you become good. You don't move from one method to another. You don't say, "Oh, this now I learned Master Tan, and I'm only going to use Master Tan for joint, but for internal medicine, I'm going to use Master Wang, and for dizziness, I'm going to use Master Tong, and for neurology, I'm going to use Yamamoto style." You can do that. You will be a good practitioner. You will help a lot of people, but you will never have your own insight on things. You can and I don't know if you know it, but Dr. Tan was a Confucianist in nature.
Okay.
And Confucius said there are 3 ways of learning.
Tell
Uh,
me.
this, the first way is copying, which is the easiest way. And we all
Mhm.
start by copying. He
Yes.
taught me, and then I copied what he said to my clinic. That's the easiest way of learning. And then the second way is insight, which is the most noblest way, that you bring something new to this world, something that wasn't here before, your own insight. But in between copying, and that's of course is the noblest way, but between copying and insight, there is the third way of learning, which is experience. And
Ah,
experience is the most bitterest way
yes.
because you fail and then you become better. So getting insights, yeah, after you practice for 10 years, 15 years, get an insight. If you do 3 treatment and you have an insight, that's not an insight. That's an intuition,
Yes.
not yet an insight.
Mhm.
Okay? So this is why when I had this idea, there is research going phantom pain, and my idea came from experiencing phantom pain in my clinic for many years. So how do you treat phantom pain? Basically, I can say you have to image the, the stump, but also image where the brain think the pain is.
Ah, good one.
When you have to do it both ways. So that's my insight, and then it's being studied, it's being researched right now in the hospital. I hope we'll have results published someday, you know.
That would be great. That's great insight. Thank you for that.
Yeah, but
So, as we're talking about Dr. Tan, since you studied with him, you knew him good, what surprised you about him? What did he say or do that you have never been able to forget?
first, um, there was no gap between the generosity of his teaching and the generosity of him as a person. He was a super generous person, super kind person in his heart. He was generous with his knowledge, he was generous with his jokes, he was generous with his energy, he was generous with his money. It was just a generous, benevolence person. Like I knew he was thriving for that. So I call him benevolence because benevolence is actually a good translation for the Ping Ren, which is like the Confucius way of looking at. And that's one thing I can never forget him doing. Uh, he loved the profession in a way that you cannot believe. You know, every single time we had a seminar together, and on the break, uh, we always ask people, you can join us, but please don't talk about Chinese medicine during the break with Dr. Tan. He needs to relax. And it only took him like 3 minutes before he would start talking about Chinese medicine because he just loved it so much. And the third thing is that he never looked down on you. He always looked, and this is not very common for Chinese masters, that he looked person to person, eye to eye, heart to heart, and he always had this idea that that you just learn it, you follow it, you can do it, you become your own master. 40 years from now, you'll be like him. He never said that you can't reach his level, that he always gave you the feeling that you can. And I've been learning with many Chinese masters and Western teachers. A lot of them always had given you the idea that you will never reach their level. You know how it is. There is always some secret being held back for later on in the future. Um, he didn't have that. His outside was his inside, and this is why I adored him so much. You know, and and it's beside the logical system, the ingenious, the the method itself, and the clinical results it's doing, the way it resonates, echoes. You know, when I just just before we started this conversation, I got a text message from a colleague of mine in Nigeria, and he said, "Thank you for giving me the protocol. My patient with the sinus infection feels so much better." And then I said that you shouldn't thank me. You should thank Dr. Tan, because this is him resonancing through me to Nigeria. It's not my personal idea. If it was mine, I would take credit for it. I'm not a not a modest person, but
Wow, he sounded like a wonderful man, Dr. Tan, giving a lot
he
to
he
everybody.
was a wonderful man. In my life, he is a wonderful man.
Oh,
You know, there is a saying in the Tao Te Ching. I hope I'm translating it right to English. And it says that to die without being lost means to live forever in the future, in the presence.
mm,
And what does it mean to die without being lost? And everybody dies at the end. And that means that when you are on this planet, you have to do something that resonates after you're gone. Plant a tree, grow flowers, grow vegetables, have kids, practice China, do something. So I think that he passed away, but he's not lost. And I think it's like fulfilling this particular sentence that I really love from the Tao Te Ching. And I hope he's happy.
yes, he
He was a
fulfilled
happy
that.
person. You can't take it. He was a happy person. Um, he loved life. He loved eating, loved drinking, loved partying. Was a happy person.
Beautiful. That's great to hear, really. So let's bring it into the clinic. You
Yeah,
have taught the balance method to therapists all over the world.
yeah.
So here's what I'm really curious about. Where is the next layer? What is the piece most practitioners haven't fully unlocked yet? The thing that takes a good treatment and make it really land. If you could
I I
whisper
think
one
that
insight into every therapist's ear right before the next treatment, what would that insight be? What would you say?
oh, that's two different questions because the one is a very big idea and the other is like more practical. I think that when I see it all over the world, when it comes down from orthopedic to internal medicine, our main problem is diagnosis.
Mhm,
That's the challenge. That's the challenge that we have to overcome. And it's always starts because orthopedic is easy. Orthopedic is like everybody's basic training in their mind. They understand meridians. You know, only for orthopedic you asked where the disease is before you practice balance method. For I don't know diarrhea, you would never ask where it is. You probably get the answer in the bathroom, but you won't get where is it. So the biggest challenge is to move from orthopedic to internal medicine. That's one thing. I have a system of diagnosing that helps you. There's like you follow a guideline and it helps you. Um, that's one thing. Second part of the big question is always remember that Dr. Tan gave you the basic principles of treating, and he's basically saying, we normally people learn in short-term seminars, like you do 2 days, 1, 2, 3, 2 days global balance, 2 days conversion. One of the programs he built with me in the Israeli Town Center was a year internship that you learn the whole balance method every week. Then people are much better after that because you don't have to wait for another year before you have more information. Uh, so one of the things I really want to say to practitioners that you must always study more. It's not that a 2 day seminar or a 4 day seminar is the whole study. You also need to understand Chinese medicine much better. You also need to understand the meridian system much better. I'll give you an example. If, for example, the balance method is mainly talking about the Zhengjing or the main meridians, not really in a way talking about, for example, the Jingjing, the muscle meridians. Now, we go through our needles to the muscle meridians. So sometimes we treat the muscle meridians. But understanding Chinese medicine, you also need to understand that Jing Jin, or in their not so good translated English way, the TMM, uh, have a different sequence. They don't follow the Zhang Jing sequence. They don't follow the main meridian sequence. They don't start with the lung. It doesn't go lung to large intestine to stomach to spleen. It goes bladder to gallbladder to stomach, and then so forth and so on. It's a different sequence. If it's a different sequence, maybe we have a different table for Jing Jin.
Wow.
Now, Dr. Tan never talked about that because it's not like he didn't knew that. He said, well, what's really going to happen is that if the problem is on the Jing Jin, then you will probably need to go through the matrix to find the right one, because they are in a way in some form of sequence. But some problems lie on the Jing Jin, and the meridian there doesn't make sense. For example, give you a good tip for the clinic tomorrow. If you have TMJ and it's on the masseter muscle, this area is stomach meridian, right?
Mm-hmm.
But the masseter muscle itself belongs to gallbladder Jing Jin. They
Ooh, that's
overlap
different.
each other.
Mm-hmm.
Actually, the outer part, the muscle itself, is gallbladder, not stomach. And this is why people sometimes, not in all cases, they go to TMJ, the pain is here, they go to the pericardium, they go to the spleen, they go to the large intestine, and it just doesn't work. Then they get frustrated and put needles here.
Uh-huh.
But the real reason it's not working is because you're balancing the wrong meridian.
Wow. So to
You
everyone
have to,
listening, that's the homework they should do.
yeah. So that's something I shared with Dr. Tan. This was one of my insights. And he was really enthusiastic with it. He was really happy with that. Now, it's not just the muscle meridian. Muscle meridians are kind of an easy pathway. We have it on the Ling Shu. The pathway is very clear. What about the Jing Bie? Now, again, we use Bie Jing terminology. It's like our second system, right?
Yes.
But that's just the Chinese words. Bie means uh, branching, and Jing means meridian. So he just translated into branching meridians. But Jing Bie in Chinese, it's the divergent.
Ah.
It's a different sequence. Every time I teach the balance method in China, there is always a Chinese doctor saying, you should say Jing Bie, not Bie Jing. And I explain, I'm not referring to the Jing Bie that's are on the Ling Shu. I'm referring to just the words
Mhm.
in themselves, which is like branching meridians. But they're not the diversion. They're not the diverted meridians. The divergent have their own sequence too.
Wow.
And another problem with the divergent is that they don't have a connection to the main meridian. So if you want to treat a divergent meridian problem, you either need to work with the extraordinary vessels or the muscle meridians or the Jingbie themselves. Luckily, we don't see a lot of that in the clinic. I mean, or we see it, but then we can't help, and then we don't understand why. We just so this entire meridian system is super complicated in a way. And I remember talking to this with Dr. Tan, and we laid it out. You have the muscle meridians, you have the Luo meridians, you have the main meridians, you have the divergent meridians, you have the extraordinary meridians. This is a whole network, and every single technique you do in the Chinese medicine is years to study. You know, in China, you study gua sha for years. You don't just one lesson gua sha. And he said, yeah, but main meridians are our everyday function. So if they are working properly, they will clear the luo and preserve the muscle meridians. And then the only problem you will see is sometimes in the extraordinary vessels. So this is why he focused on these meridians. Well, that's like a behind the scene kind of conversation that I had with him. We had a lot of philosophical conversation about Chinese medicine.
Ah, I love that. That brings a whole different layer to the balance method as we know it.
Yeah, actually, even one of the things I really love about Dr. Tan, that he would take super complicated ideas that take you years to learn, and he said, I'm going to make it simplified, but it's not going to be perfect.
Yeah.
But at least you will be able to help 80% of the people.
And in this way, he helped a lot of
Yeah.
acupuncturists.
Actually, it's like, I don't know if you're familiar with the Buddhist concept of Hinayana and Mahayana.
No.
There's two streams in the Buddhism. One says you need to take one student and bring him to nirvana. So you
Okay.
take one student at a time. You take one student at a time, cross the bridge, one student at a time to cross the river. And the others say you take 100 people and you bring them
Ah,
close to perfect, and then they have to do the thing themselves. Dr. Tan was a second kind of person. You take his Bazi, for example. Bazi, it's an ingenious Chinese divination system that takes a lifetime to understand.
it's
And he
difficult.
and he did it in a way that after 5 minutes, you can help 80% of the people. Five
Amazing.
minutes. Always said, make your day stem happy. That's it. Don't don't
Overcomplicated.
don't overcomplicate it. Take look at the elements of the person, look at his day stem, connect the five elements to his day stem, make that happy, make that work, everything will be fine. It's like the basic idea in 5 minutes, then everything else is just technique. But actually understanding Bazi, that takes a lifetime. I can quote my Bazi teacher. It's not Dr. Tan, I have to say. And one of his quotation that I love the most is that he said when he'll be 75 or 80 and he couldn't do acupuncture anymore, he will just do family treatment according to the Ba Jing, or couple therapy according to the Bazi. And so many things will be solved in life if you just understand who you are, what's your illusion, who are your parents with their illusion, and who are your kids,
And how it all comes together.
how it all comes together. Yeah.
Yeah. Wow. Okay, let's talk about a real case.
Yeah.
Someone that walked into your clinic and you used the balance method, and then something happened in the room that made you think, this is why I want to teach this. Walk me through it from the moment they sat down to what you did and what changed.
I kind of went into a different way because I actually started learning the balance method because of a clinical issue. And then from the very beginning, it was very clear to everybody that I'm going to teach it. Everybody knew it from the very get-go. So it's not like a case that drove me into teaching. There was a lot of cases that I could share the change in the person life. But you know what? I would share that two stories from the hospital.
Okay.
Okay, two stories from the hospital. People love hospital stories. This first person came and he had an injury with a saw disc. A saw disc cut through his hand, cut through his middle arm, And
Wow.
they went into surgery and they reattached everything, but they didn't know if the nerves are damaged or not because of the inflammation after the surgery. And this person was really in a problem because 2, 3, 4 days after surgery, the inflammation still didn't run out, and he couldn't move his fingers at all. And they started thinking that his nerves are damaged. So they called me and said, "Do your weird magical things and see if you can help this person." Um, so actually, I balanced the yin hand meridians. It wasn't very sophisticated, and I imaged the scar tissue area. And after a while, he just moved his fingers. Then I told the doctor, "You see, the nerves are not damaged. It's just the inflammation. Give it another week, and it will go away." Because when actually this is like the core understanding of what you're doing in acupuncture. You know, uh, it's a story within a story. But people always ask you, I guess, as a practitioner, the your patient asks you, how did the Chinese come up with acupuncture?
Yeah.
And then we always tell them, I don't know what they taught you. When I was a student, they taught me all those stupid stories about an old man going in a rose garden, and a thorn got into large intestine 4 and his headache went away, or the soldiers came from battlefield with arrows stuck in their body, and then they felt so much better in other stuff. And I was like, yeah, sure, an arrow got stuck in me, and oh, my neck feels so much better. Doesn't make any sense at all. But the reason it doesn't make sense at all, because all of these stories are describing a discovery, like somebody discovered it. Now, if it was a discovery, I can assure you that it was not, that the Chinese were not the only one to discover it. Just look at all the other stuff. Every culture has massage therapy. Every culture have herbal medicine. Every culture understood nutrition can help you. Every culture understood at a certain point that humans are responsible to their own health and not the gods or the shamans or the deities or whatever. Every culture had exercise. Every culture had warming or some form of warming or cooling system treatment. So all the other Chinese tools everybody have, just different because of the culture. Acupuncture is the only thing that just the Chinese have.
Hmm. Okay.
So that means it's not a discovery. It's not a discovery because they were looking for it. So whenever a patient is asking me how did they come up with acupuncture, I tell him that's the wrong question. The question is why they came up with acupuncture, not how.
Interesting.
And why is because they are the only culture, the only ancient culture that humans are really a part of nature and just a mimicking of nature. The only advantage a person have over animals is its capability to connect heaven and earth, which means he can see stuff heavenly and bring it down to earth. But we are all just a reflection of nature. So they look at nature and they see the rivers are flowing. And if the river is flowing, then the riverbeds are thriving. So all you do as a practitioner, you need to make sure that the rivers in the body are flowing and are well nourished. And since they also did live surgery rather than cadaver surgery, which was not allowed in China, historically wise, this is why they knew anatomy so well. They knew anatomy very well. They knew even stuff that we are just discovering now in Western medicine. For example, the difference between the fat on the heart is different than the yellow fat in your abdomen, which is different than the white fat. And this is just modern science is just discovering this now. But they did live surgeries. So they saw all this blood flowing. And in their culture, the flow is more important than the anatomy. This is why flow is more important than anatomy. This is why our entire medicine is designed to preserve flow. Now, if you want to preserve flow, then the easiest way is to do this, right?
Yes.
And then you say that's not deep enough. Let's take something deeper and carve through it. And when that's not deep enough, you need to go really inside. Then you use subtle needles.
Uh-huh.
And if you look at our ancient 9 needles, for example, 3 of them don't break the skin. It's only 6 of them breaks the skin. So they knew that you can do a massage and you can do a pressure and you can do a carving, and then you need to go inside. So if I translate acupuncture to today words, acupuncture is basically a microsurgery that moves blood from one place to another. And by moving blood, I also move the Wei Qi and the Ying Qi and the Shen. So going back to my patient, I move the Wei Qi, Ying Qi, Shen to his scar tissue, and then it opens. And now you see that the other tissues are not damaged. Once the needles are out, yeah, the hand stopped moving again. But after a few days, it came back. Now, this is why I want to share this deep understanding of that concept with Chinese medicine students for 2 reasons. First, so they will understand what they're doing and why it's working. It's not a magical thing working. It's not
Yes.
like you. And by understanding the deep philosophy of things, people can have deep understanding, and then they have their own insight. This is how you grow.
Mm.
This is how you grow. I also remember another conversation with Dr. Tan saying that I told him, ask him how something, some advice about teaching, and he says, "You go into the classroom and tell them you do this."
Okay.
And I said, "Yeah, that's going to work for you. You're a Chinese master. That's working for you very well. As you can see, I'm not Chinese. I need to convince people that I know what I'm talking about. It's not, I cannot just say, do this. And you go, who is this person? And then he said, oh, so you need to understand the Neijing better. And yeah, I got you. I understand. You can't go, so you can't just tell your student, do this and that's it. Don't ask questions. It says, I told him, no, I can't do that.
It doesn't
They
work
will
that
ask
way.
questions. They will ask questions anyway. He said, so then he said, then learn Chinese medicine better. So you need to be better. So this is a good case that really drive me to the understanding of the my-square surgery concept and the balanced method, and wanted to share that idea. I have tons of these cases. Um, I remember when I was a very young practitioner, there was another patient coming after a car accident, and he had pressure on C6, and they weren't sure if they needs to go to the operating room or not. They weren't sure that they could save. They didn't know if it's more dangerous or not, because he could move his legs, but he couldn't move. He could move his shoulders, but not. He couldn't do this.
Oh.
He couldn't hold things. If he would hold, they would drop. And they said the pressure is in a way problematic, but we don't know if it's inflammation pressure or mechanical pressure. And if we go into surgery, we might cause more damage. So they gave him some steroids and waited out. And then they called me because, I had a doctor who really loved acupuncture. So she would call me to everything. And this doesn't sound like a case that we could do something, right?
Hmm.
The patient, you don't even know what meridian is sick, you
Yeah.
just don't know. But she called me, and The professor, the head of the department, is there, and she said, "Look, look, he's gonna help him. Look, look." I'm
Oh
like,
no.
"Shit, they're gonna throw us out of here." So I said, "Okay, let's think simple. He has pressure on C6. Where is C6? It's somewhere here, right?"
Mhm. Yes.
So I look for Ashi, was really sensitive. I put 3 needles. I said to the patient, "Do you feel the needles?" And then he went with his hand. He said, "Yes, I can." And then you see that he was moving his hand.
Oh.
And then I went, "Wow." And the doctors went, "Wow." I was surprised exactly like they were surprised because I did not expect that. And then I said, I come to my senses and I said, yes, that's inflammation. It's not mechanical pressure. The steroids into it will work. Whew, I dodged that bullet.
Wow, that's a great story. I loved it.
Yeah. But one other. Oh, we had this amazing case of post operation hiccups.
Ah, tell me.
Post operation, when you put people in anesthesia, sometimes when they wake up, they have nausea or hiccups. Now, this patient had hiccups for 5 days.
Oh no.
And I'm not talking about the cute hiccups like once every hour. I'm talking that this patient sitting in front of me going
Oh no.
like
Violently.
this, and they were like lost. And that was the first time the surgical department and the gastroenterology called us. This patient, they let him drink ether because they, in a way, diluted one, of course,
Yes.
safe. It's a good hospital and not crazy people. It stops nausea, but it didn't help. And they said, okay, we're lost. Let's call the magicians. They were so lost that they didn't even say magician. They said, let's call the wizards, the witchcraft, the we will do anything at this particular moment for this patient. And I remember him sitting in front of me. He couldn't lay down. He looked so gray and pale because after 5 days, almost no sleep, almost no eating, nothing. And he was sitting. So all I can do is like palpate his abdomen and find sensitive spots around CV12 area, a little bit higher than CV12. And I just did the 4 magical treatment imaging to that area. And the patient, while the needles are inside, he was like, "Oh, I don't." It goes out and says, "I don't know. I think I need to vomit." And then he vomit, and then all the hiccups stopped,
Wow.
just like that. Stopped completely. No more hiccups.
Great.
I
He
had an
was
I had another one with this nausea thing. I had a patient. He was injured during his military service. Terrible accident. Terrible physical condition. I don't know if you can imagine your leg being caught in a wheel and just twist like that while still connected to you. So terrible physical condition, and he came and I started working on his pain because he was in terrible pain, and the injury happened 32 years ago.
wow.
But he had pain all the time, so I helped him with the pain, and it was a very difficult treatment. And after some sessions, he told me, the pain is a little bit better. He didn't expect much from treating that pain because, but sometimes I have another problem that all the doctors are ignoring. I have nausea from the injury. 32 years, every day I have nausea. It's not terrible as the pain, but it bugs me. but I can't, nobody addresses that. But I already put the needles in for the pain.
Okay.
And then I said, "Oh, why are you just telling me that at this moment? Let's try and help you out." I palpate his abdomen again. I found something really sensitive around CV12, and I put some needles on the scalp, and then the sensitivity went away in CV12. And I said, "Okay, this is what we did now for the nausea. Next time, tell me when we start, because the treatment was already,
Hmm.
scattered." The nausea went away. 32 years of nausea went away,
Never came back.
never came back.
Wow.
But not all cases are actually, everybody loves talking about the miracles. We should also talk about the hard cases that people needed 20, 30 treatments to get better. This is
Hmm.
actually much more common. I had a patient with shingles pain, post-herpetic shingles pain, for 28 years. And it runs from like C1 towards the upper of her neck. So it's not a cranial. It took us, I guess, like 40 treatment before she felt much better. But she felt much better. I
Oh,
think this is an even bigger accomplishment than the
yes.
miracles.
Yes. Yes.
Um, or people coming with 8 month coughing, and then you realize it's because of grief. And then you just do 8 magical point, and you add the lung taigua, which is perfectly matched the 8 magical point. It just add lung 5 and 11, because you have 5, 7, and 11,
Hmm.
and then the cough goes away. But it's not after the first treatment. It takes like 3, 4, 5, 6, 7, sometimes more.
Yes.
And actually, I want to say to all balanced method enthusiasts out there, normal people, it takes them time to heal. Don't indulge yourself on the miracle. A chronic condition needs basically 10 weeks, twice a week, 3 times a week. That is what you will normally see in your clinic. Okay? Even if you see on the demo it's working so well for frozen shoulder, the frozen shoulder to heal takes time. So the pain will come back and you need to do it again, and the pain will come back and you need to do it again. And it will take time. If somebody comes with arthritis of the knee, remember that there is physical damage there. It takes time to heal, or it takes time to get better. You have a scratch on your skin, it takes a week or
Yes.
2 weeks in my age. Uh, so an arthritis of the knee he will feel better, but if you want it to last long, it takes 2 months. And that's normal. This is why in my book, every single case I wrote exactly how many treatment I did, that give the right perspective. Because when you read case studies online, you always imagine they just did it one treatment or two treatment. And it's never one treatment or two treatment. It's always like 20 or 30. Doesn't matter, TCM, Yamamoto, Kiko Matsumoto, Japanese acupuncture, Master Shen, Master Wang, Master Tong. They always do a lot of treatments. It's not just one.
Yes.
Okay,
That's
so this maybe my best, maybe the best sentence I said today.
yes, that was advice everyone needed to hear because it's so true. It's so true.
Yeah. And
Yes.
and it's okay to fail.
Mm,
You become
absolutely.
better if you
If
if
you
you
fail.
fail.
Yeah.
Actually, the best cases are the one you fail at the beginning and then you change something. These are the one you learn the most.
Exactly. Yes.
Yeah, and always check the patient. Always check the palpate his abdomen, palpate his pulse, palpate his meridians. Even if you don't understand what you're doing, you will understand eventually.
Yes.
You know what Dr. Tan said about pulse?
Tell me.
He said there's no wiry pulse. There's only the master wiry pulse.
Oh.
So that's my wiry. And then if you feel this wiry, you do Zhui in Shaoyang. But if you go to another master, he may say that's not wiry. And then he
Aha.
will tell you to do something else. And then you need to see which one worked. Now coming to us, you feel some pulse, even if you don't know what it means. You feel it. You give it a name. I don't care if you call it wiry or you call it Johanna. It doesn't matter. But this is your Johanna. And then when every time you feel that, you do Dwayne Xiaoyang and it works, now I have my own master pulse. Now I have my pulse.
You create your own understanding.
Always, and always think about the patient as one of your teachers.
Mm.
You help him, but he helps you. You help him to feel better. He helps you to become a better practitioner. So don't forget to learn from your patient.
The patient helps you to grow.
Definitely. You
Yeah.
are not a practitioner with no patience,
Ah,
right?
right.
And on the other hand, on the same platform, on the same level, it's okay to just copy
Mm.
all your life. You just follow some idea, you practice it, and you help. Just shoulder pain. Perfect. You do good. You do good to the world. Not everybody needs to treat cancer. Not everybody wants to do that. Not everybody wants to deal with PTSD. Not everybody wants to deal with people with COPD because it's difficult and you
Mm-hmm.
don't see a lot of results or a good one. You just help. It's frustrating. If you feel that this is who you are, fine. Just help people with shoulder pain. I remember, when the cosmetic acupuncture came to the world, to the West, many years ago, I kind of looked down on it. I said, "Oh my God, cosmetic, really?" But now I totally changed my mind. I still don't know if it works or not because I have no knowledge about that. But I say, hey, if you help people feel better about themselves, you go ahead and do that. I don't care. I don't care what you're doing.
In a way, it's the most beautiful job we have, helping people.
Yeah, that
Yeah.
basically that what drove you to become a practitioner to begin with. What right? You want to help people, so it doesn't matter if you help them with their wrinkles, their diet, or their Crohn disease. You only, for some reason, feel proud about Crohn disease more.
Yes. All right. So, Adi, before we wrap, I want to ask you something different. And not about work this time, but about you. If you could send a message back in time to yourself, so 20, 25 years ago, just starting out, what would you tell yourself? What does the younger Adi need to hear?
Uh,
It's a difficult question.
yeah. You know what I would say to myself? Uh, uh, don't hold back on your dreams. Um, you this profession took me all over the world. When I just started, I couldn't imagine it will even look close to this. Now, when I say don't hold on your dreams, that means that your generation, the younger generation, you need to, just like I'm standing on Dr. Tan's shoulder, you need to stand on my shoulder. You need to be better. And so don't hold on your dreams. If you have a dream, you go out, you follow it, and 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 believe in yourself. Really believe in yourself. That this is an amazing profession, and you're doing good, and you're thriving by doing good. Um, and believe in that. Yeah.
Younger Adi would have been proud to have heard that from you.
Yeah, you would probably ignore it. The young Adi will just go out. Who is this weird old person? He doesn't know what I feel. And yeah, I know it because I always tell my students stuff and they can't listen because they are not practitioners yet.
Yes.
And I say the same sentence when they are practitioners. They say, "Why didn't you tell us that when we were student?" And I'm like, "I did.
I did.
I did. You just didn't hear it."
All right. Thank you so much. Thank you for
Yo,
the work you do. Thank you for studying, for improving the balance method, for what you carry forward from Dr. Tan, and also for being so open today. Thank you for that.
no, thank you for having me. I really enjoyed it.